One is called the cephalic and one is called the basilic. Okay? Now, cephalic, that's missing its H. Cephalic means towards the head, right? So look at where the cephalic vein is. It's actually on the outside of the arm, more laterally positioned. And the basilic is on the medial side of the upper arm. So when we go to our vascular arm, remember, we're going to have our axillary artery and vein, and then it will become brachial artery and vein. But what we're going to have now is this very loose one here is actually the more superior or lateral. So this is our cephalic right here, and the basilic is this great big thick blue one right here. Okay? The brachial vein sits right next to the brachial artery right on top of the bone. But these great big blue veins that are more superficial, cephalic and basilic. Okay? This broke. Now what you're going to notice is that the cephalic and basilic veins in the antecubital region, they branch. See how they branch? Then they cross each over and come back together again. And that can cause, it can be a cause of confusion in trying to name the blood vessels. But we only need to look at the cephalic and basilic, and then in the antecubital region, okay, we're going to have one vein right here, and it goes across from the medial side to the lateral side. This is called the median cubital vein. This is a vein through which much of the venous blood is drawn, at least in the antecubital region, one vein, okay? And notice that it comes, it's actually going to drain from the ulnar vein into the basilic vein. So it actually goes across from this lateral side to the medial side. So that's our median cubital vein. Unfortunately, on our vascular arm, it looks like they're trying to repair it, so it has tape on it. Okay, but at least that makes it easier to identify. Okay, so there is your medial cubital vein, and it needs to be repaired.
Make sure you use that model.
Yeah, that's the only one we have.
Oh, good.
Okay, so our cephalic is going to be this great big loose one, that actually is going to be more laterally located or towards the head. And then basilic is the thick big blue one that we have right here. You can see just underneath it is going to be the brachial artery and the brachial vein, which is also just about the same size as the brachial artery. Now, when we get to the forearm, draining the forearm, remember we had blood coming to the forearm, we had our ulnar and radial arteries. Right next to them draining the forearm is the ulnar and radial veins. You can see them right next to the arteries, okay, right on the bone, okay. There is one other structure we need to know, and that is a very superficial structure called the palmar arch. Okay, you see this right here? It's just an arch of blood vessels in the palm. That's all it is, okay? Unfortunately, we're not doing any. I wish we could do more looking for veins that blood are commonly drawn from, like from the back of the hand, but we're not doing that here. I'm sorry.
Don't.
Yeah.
Okay.
It would have been kind of a little.
I'll forgive you.
Thank you.
Okay.
So those are the ones we're doing. So for our arms, blood comes from the palmar arch. We have blood drains through the radial vein and the ulnar vein. They sit right next to the radial and ulnar arteries. When we get to the antecubital region, we have the median cubital vein. It goes from laterally to medially, median cubital, and then it will join the basilic vein, and then we have our cephalic vein. Those come together. Basilic will come together as the axillary and then subclavian. Okay, the subclavian will then join the right brachiocephalic vein, and that will drain into the superior vena cava and then into the right atrium. Okay. All right. So that's our arm. We've done our head and our arm. Now let's look at draining the legs and then the torso. Okay. All right. Training the legs. There aren't too many here that we need to do.
Wonderful.
In fact, just about all of our veins match the names of the arteries.
Wonderful.
We see in the lower, or the lower legs, we have our posterior tibial and anterior tibial veins. They run right next to the anterior posterior tibial arteries. They bring blood up, and in the popliteal region, what do you know? They come together and form the popliteal vein, which is right next to the popliteal artery. Then what happens is up through the thigh, we have our femoral vein, which happens to run right next to the femoral artery. That femoral vein, when it enters in, goes out of the leg and into the pelvis, will then, its name will change to the external iliac vein. Fortunately, it sits right next to the external iliac artery. That external iliac vein will then join with the internal iliac vein, okay, which is coming from the lower pelvis, and become the common iliac vein. And then those two join together to form the inferior vena cava. Okay, so all of our veins so far match the names of the arteries that travel with them, except for our inferior vena cava, which is the venous return up through the abdomen and thorax to the heart. Right next to it, coming down, is the aorta. Okay, so all our veins are named the same. There is one other vein that we have to identify. It is an anomaly, and what you're going to see in each leg, from the medial malleolus, the ankle, the bone, bony marking on the inside of your ankle, all the way up to the external iliac vein. There's a very, very long vein. This is called the great saphenous vein. This is a very important vein because this is going to be removed for
replacement with your heart.
For bypass surgery of the heart. Yes, thank you. So it's also used for anytime there has to be some kind of bypass or vessel transplant, this vein is usually removed. Why? Because we have collateral circulation in the leg, so it's not absolutely necessary. Okay. All right. So that's our venous drainage of the legs. We have our anterior and posterior tibial to the popliteal vein, to the femoral vein, to the external iliac vein, to the common iliac vein, to the inferior vena cava. And we also have the great saphenous vein to the external iliac vein, to the common iliac vein, to the inferior vena cava. Okay? So they all run essentially with the same name as the arteries. Okay. Now let's look at the abdomen and the venous return from all the structures in the abdomen that we saw. Okay. Well, first of all, we saw that the celiac trunk sent blood into the splenic, hepatic, and gastric arteries. Right. Now, blood from the spleen will go back to the inferior vena cava, bringing blood to the heart, through the splenic vein. And fortunately, on our models here, our splenic vein runs along with the splenic arteries. They're both together. Okay? We can also see that same thing is true with the renal vein. Renal vein drains the kidney, and it runs along with the renal artery. A few other things are the same as well. Our gonadal arteries that come off the aorta run along in front of the psoas muscle to the gonads, and they run along with the gonadal veins, or ovarian testicular veins. These veins, however, one actually on the right side will go directly into the inferior vena cava, but the left gonadal vein, make sure you have a look at it. The left gonadal vein doesn't go into the inferior vena cava. That means if it did, it would have to go across the aorta and then join with the inferior vena cava. So it's such a tiny vein. Every time blood flows through the aorta and the aorta moves, it can actually irritate that vein. So instead, this vein drains into the left renal vein, and then into the inferior vena cava. Okay, so that's a slight variation there. We have our superior and inferior mesenteric arteries and veins. Again, the superior mesenteric artery goes to the small intestine. We can see branches of this artery around the small intestine. Inferior mesenteric to the large intestine. We can see branches of the arteries and veins near the large intestine. Now, venous drainage from the intestines is slightly different, particularly our small intestine is slightly different, and we're going to cover that separately because there is a vessel called the hepatic portal vein, which will actually go into the liver, and it will drain the intestines, and we'll talk about that separately. But so far, in terms of our abdomen, the splenic, the gastric, the renal, the gonadal, and we can see next to the intestines, the superior and inferior mesenteric, they all run with their arteries, okay? And now I'm going to look very carefully at the venous return from the small intestine and what we call the hepatic portal system, which is a little bit different. Notice that I didn't say there is a hepatic vein. Remember our celiac has three? We have a splenic and we have gastric, but the hepatic vein is slightly different. The hepatic vein we are not going to see in these models. Instead, we will see them on a large model of the liver. Because we're going to see that our hepatic circulation is probably the more complicated aspect of the circulatory return to the intestines. And here is the back of our liver. The liver actually sits in this. Sits right in here, like somebody just stabbed me with a ball, right? Just sit here like this. The gallbladder should just be peeking out the bottom. That's that green thing. And if I just pull my liver out and turn it around so you can see what's behind this great big thick blue thing, this is the inferior vena cava, bringing blood up to the heart. Okay? See these veins joining it? These are the hepatic veins. Okay? This is the venous return from the liver. Okay? But we're going to see that there's many other veins in the liver. We see blue vessels, those are branches of the hepatic vein, but there's also purple vessels. These purple vessels are what we call hepatic portal veins. And we'll talk about that in a few minutes. The red vessels are going to be hepatic artery branches. Okay? And then the green will have to do with the bile ducts. The branches of the bile ducts. Okay? So again, our inferior vena cava is here, and these branches going into it, hepatic vein. Alright? So we'll look more closely at this when we do digestive system. This will be in our second practical. But when we do digestive system, we'll look at those structures once again. Alright. So, again, all of the veins that you have to be able to identify. And let's just look at that from head on down. Okay? In the head and neck area, you have to be able to identify the right and left jugular veins. Both of these veins are going to join the right and left brachiocephalic veins, and those will come together at the superior vena cava. Also, the right and left subclavian veins, the right and left axillary, and when we drain our arm, we have to go from the palmar arch, right radial vein, left ulnar vein, to the right median cubital vein. Here we have our right basilic vein and our right cephalic vein going up to the axillary vein, to the subclavian, to the brachiocephalic, the right brachiocephalic vein, to the superior vena cava. Okay? Right? Remember, rights and lefts are going to be important in this practical. Okay? Draining the legs. Okay, we have our anterior and posterior tibial veins. Here's on the right side. We have our right popliteal vein going to the right femoral vein to the right external iliac vein. That will then lead to the common iliac vein on the right side. And here we have our right internal iliac vein. We also have to identify the great saphenous vein on the right and the left. There's a great saphenous vein. And of course, all of these will ultimately drain into the right and left common iliac veins and then into the inferior vena cava. Abdominal venous drainage, hard to see from this, but from the gonads in the pelvis, we have the right and left gonadal veins. Okay, our right gonadal vein will go right into the inferior vena cava, but the left gonadal vein drains into the left renal vein. Okay. We also have our superior and inferior mesenteric veins. We don't see them here. That will actually drain into what we call the hepatic portal system. Our splenic vein and our gastric vein we don't see here, and the hepatic vein for the liver, again, we don't see those here, but we will see them with our hepatic portal system diagram. Okay. All right. So those are all of the veins you guys need to be able to identify.
And you said in the head we don't have to do anything?
No, just the jugular vein.
Just the jugular. Okay.
Vein, yeah. Okay. With the arteries, it's a little bit more. Okay.
Yeah.
So yeah. All right. So what you notice, and notice the veins and arteries that have the same name that run together. Okay. Those will be the easiest for you to identify, and then you don't have to focus on those, then you focus on making sure you learn the blood vessels that are maybe a little less common or harder. For example, the veins in the forearm, the venous return of the arm is not like the arterial supply, particularly in the cubital and brachial areas. So, you want to focus on that split. Okay? All right. So we've looked at the slide of the artery and the vein. We've looked at the list of arteries we have to identify, the list of veins we have to identify. The next topic really is the lymphatics. But before I go into lymphatics, I really would like to, well, actually, I think we'll do that in lecture. Yeah, I can give you the list of lymphatics that we have to identify. In looking at that list, it's a very short list, and it's just one model. It's just one model. So let me bring that up. Here. Model. Okay, let me bring this up. This is the model. You have an image of it in your packet. Okay. And there are only a few structures that you need to be able to identify that are part of the lymphatic system. And we'll see that the lymphatic system, we'll look in lecture, that it consists of a number of vessels that carry lymph fluid, which is slightly different than blood. It's very much like the liquid portion of blood without the red cells. And lymph nodes and the spleen, essentially. This is our lymphatic system. So we'll identify structures for that. The thing is that with this particular model, as I said before, there are some blood vessels we can also see on this model. So first I'll show you the